Okay, again, good afternoon, everyone. Thank you for joining us for a webinar on developmental disabilities in Ohio, a system in transition. Presenting today are Rose Frech, Research Fellow, and John Honeck, Public Policy and Advocacy Director, and Edward D. and Dorothy E. Line Fellow at the Center for Community Solutions. Rose will be starting us off.
Okay, everybody, welcome to the webinar. Thanks for being here. Again, I'm Rose, here with my colleague John, and today we're going to be discussing the developmental disability system in Ohio. Our plan for the next hour is to provide an overview of the system, to discuss funding, and specifically address issues related to residential services and Medicaid waivers, as well as day and employment supports. In addition, we will be reviewing recent changes to federal Medicaid rules and the significant proposals related to this system that were included in the governor's budget. This presentation is based on our just released report titled Ohio at a Crossroads. It just came out on Friday, which was funded with support from the Cleveland Foundation. We spent the past several months researching the system in Ohio, analyzing data, and conducting a series of stakeholder interviews across the state with people from the department, with county board superintendents, providers, advocates. The full report is available on our website alongside some really cool interactive maps. So please check that out when you have time. Okay, so what is a developmental disability? Developmental disability is really an umbrella term that includes a wide range of specific conditions. This includes intellectual disabilities, Down syndrome, cerebral palsy, autism spectrum disorders, language and learning disorders. However, specific definitions of the term vary, and not everybody with a developmental disability will necessarily qualify for services. Specific criteria is outlined in the Ohio Revised Code, which provides the state definition, which primarily guides eligibility determination for services in our state. These criteria include the disability must manifest before age 21, that the disability is not attributable exclusively to mental illness, that it's likely to continue indefinitely, and it must result in at least 3 limitations in the areas of self-care, language, learning, mobility, self-direction, ability to live independently and or to work, and lastly, the disability must require some form of treatment or services. An estimated 1 to 2% of the population have developmental disabilities, so this represents about 110,000 people in Ohio. Okay, you can see here we have a map that shows the estimated prevalence of people with developmental disabilities. This data comes from the Scripps Center at Miami University. If you're not aware of this resource, it's very cool. They have a lot of population projections and other great information. So as you can see, these projections really mirror the population. You can see higher concentrations in areas with more people, particularly in our large urban centers. We know, however, that there's other factors that could impact this distribution that are not taken into account with this data. Environmental factors like exposure to certain environmental toxins and variable rates of preterm birth could impact these rates. Also, we know that in some cases, people might relocate to areas where services are known to be better, which could also have an impact on this distribution. Okay, so let's move on and start talking about services. Throughout our country's history, individuals with developmental disabilities were not treated well. Historically, the services that were available for individuals with developmental disabilities were provided almost exclusively in institutional settings. Oftentimes, these facilities were plagued with really poor conditions. Abuse and neglect were common. There were also many misconceptions about people with disabilities and the cause of developmental disabilities. Individuals were not fully recognized as people and were often treated accordingly. However, over time, thankfully, this changed. In the 60s and 70s, a movement grew, fighting for basic civil rights for individuals with developmental disabilities and emphasizing that protection should be in place to assure that individuals are treated appropriately. Many involved with this movement see this as a civil rights battle, similar to movements seeking equal protections for gay and lesbian people and African Americans. Both the Americans with Disabilities Act, or the ADA, which was signed into law in 1990, which prohibits the discrimination of individuals with disabilities, and the 1999 Olmstead decision, which is a U.S. Supreme Court case that also addresses this issue, are really important moments in this movement. So out of all of this struggle, the system we have today was developed to provide humane service and support to individuals. And overall, we've made a great improvement in the treatment of individuals, and we are making strides in how society views people with developmental disabilities. But progress is really ongoing, and there's still a lot of work that needs to be done. We do continue to have services that are available in institutional settings, but also in the community. And finding the proper balance is really an ongoing debate within the developmental disabilities community. Today, it's the Ohio Department of Developmental Disabilities that provides general oversight to the system. However, county boards of developmental disabilities are responsible for facilitating services at the local level. This is a similar dynamic that we see in other systems in Ohio. Boards were created through a legislative act in 1967. Previous to that, they were actually combined with mental health boards. And board members are appointed by local probate judges and county commissioners, or in the case of Summit and Cuyahoga County, the county executive. And each board is made up of 7 individuals, including no less than 3 individuals who are either eligible to receive services, so consumers, or family members of persons with developmental disabilities. Currently, very few boards in Ohio have representation by members with developmental disabilities. So local county boards are headed by a superintendent, which is a throwback to a time when boards played a major role in operating schools for children with disabilities. Every county in Ohio is served by a board, so several boards have shared administration and share a superintendent. So what do boards do? Well, boards in Ohio have a great deal of responsibility, including this important case management function. So this case management function is conducted by individuals called SSAs, or Service and Support Administrators, who work to plan and coordinate services and to facilitate communication among providers. SSAs can help to identify strengths, areas of need, point individuals towards community resources to best meet those needs, and determine which services are needed and then how those services are going to be paid for. In addition to this case management stuff, most Ohio boards provide services directly to individuals with developmental disabilities. These direct services could include early intervention services, sheltered work and day programs, transportation supports, respite for caregivers, and in some cases, residential services. Boards also rely on a network of private providers to provide these services. Some county boards have privatized most of their services, while others still continue to have a sizable direct service operation and many employees. This is like an important dynamic to remember, particularly as we talk about the new Medicaid rules here in a little bit. So boards in Ohio serve about 90,000 individuals a year. This is about 80% of the total estimated number of individuals with developmental disabilities, so it's a pretty high penetration rate. About half of the individuals served are children who might receive early intervention services, family supports, a variety of other services. Services for school-age children are primarily the responsibility of the child's home school district, though we do have several Ohio counties that continue to operate schools specifically for individuals with developmental disabilities. So we're not going to talk in detail about services for children today. We do cover this a little bit more in depth in the report, but primarily we're going to be discussing adult services moving forward. I'd also like to mention that in addition to support individuals may receive through local boards, individuals with developmental disabilities may also seek or receive services and support through other systems like local health systems, county offices of employment and family services, And while we're not going to address those services in detail today, this cross-system involvement is really common, and it's an important factor in meeting the full range of needs that an individual may have. Okay, let's talk a little bit more in depth about services, and we'll start with residential services and supports. So Ohio continues to rely on institutional care to serve individuals with developmental disabilities, and of particular importance, we rely more heavily on large institutions than many other states. These institutions are called ICFs, or Intermediate Care Facilities. ICFs can be privately owned and operated. They could be operated by a board or by the state itself. In total, we have about 6,800 people who live in ICFs in Ohio, including private facilities and state-run facilities. These services are almost 100% Medicaid funded. As most of you know, Medicaid is a federal program. The federal government pays about 60% of the cost, but the program does require a match. And in this case, the state pays the non-federal share for these institutional services. So Ohio currently has about 5,700 individuals who live in private ICFs. We have about 420 private facilities throughout the state. In addition, Ohio is home to 10 state-run developmental centers, which is what we call a state-run or a public ICF in Ohio, a developmental center. And these developmental centers house about 950 individuals. There's a lot of similarities between a private ICF and a state-run developmental center, but state-run developmental centers may be better able to serve individuals who have significant behavior issues or those who are required to be institutionalized through court mandates. Though it's important to note that many states serve those same populations, serve those individuals in those situations without the use of state-operated centers. Ohio is third in the nation for the overall number of beds we have in state-run institutions. However, a lot of people cite the importance of developmental centers in providing brief respite services to people in crisis, maybe those who require stabilization, and maybe individuals where, due to significant behaviors, a private facility may be less inclined to enroll. It was recently announced that both the Montgomery County and the Mahoning County developmental centers will be closing in 2017. So this is going to significantly reduce the overall number of state beds that we have. This is going to impact 180 residents, 485 staff members. This has been really controversial. Family members, residents, and certainly the union who represent the staff at these facilities have all expressed opposition to the closings. The state says that this really aligns with just their overall efforts to increase community services, to downsize institutional care. This will obviously also cut down on cost. But those who oppose the closings have concern that there will be insufficient supports available for those who are forced to leave these developmental centers. Okay, as you can see, there is a variation in the cost between state-run developmental centers and private ICFs. The average annual cost at a developmental center is about twice as high as the cost at a private ICF. And this is primarily because staff at state centers are generally paid better, they receive better benefits, which has implications for hiring, turnover, things like that we'll discuss in a little bit. Okay, ICFs are often scrutinized based on bed size. Large facilities are considered to be more like institutions, more regimented, perhaps more restrictions, as opposed to smaller ICFs, which are deemed to be more home-like and therefore more acceptable. Ohio is 7th in the nation for individuals living in residential settings with 7 or more beds. So like I mentioned before, we don't do particularly well in this area. In total, in 2014, almost 3,000 individuals lived in institutional facilities with more than 16 beds, while only 529 were living in 6-bed or smaller facilities. Generally, it's somewhere between 6 and 8 beds. It's determined to kind of be the most desirable or more desirable. Okay, so this map shows the physical location of ICFs by size throughout the state. Hopefully you're able to see this pretty well. If not, there's also an interactive version of this map on the website that's also pretty cool. On this map, the large red dots indicate large private ICFs with 16 beds or more, and the smaller dots indicate small private ICFs. And then the stars represent our state developmental centers, currently 10. As you can see, we have some counties who have no ICFs. 25 of Ohio's counties have no ICF beds. Now, this doesn't mean that individuals from those counties don't go into ICFs. It just means that they would have to go to another county for the service. Okay, Medicaid waivers. So an alternative to institutional care for individuals with developmental disabilities are community-based services, wherein which an individual would receive supports that allow them to live either on their own, with family, or with roommates, and to participate more fully in community life. And individuals can access these services using something called a Medicaid waiver, which is a program that allows individuals to waive their right to institutional care in lieu of community-based services. So waivers pay for programs like personal care and homemaker assistance, potentially respite for caregivers, accessibility modifications for their home, nutrition assistance, certain therapies, transportation is certainly a big one, and also day and employment programs. So there's 4 different types of DD Medicaid waivers. We'll talk about that in just a second. And all but one of those waivers does not currently include nursing services. It doesn't cover nursing services, which can be problematic for individuals who need those services. People may be able to access limited nursing services through the state Medicaid plan. However, this can still create barriers to living in the community for an individual who has some extensive nursing needs. Also, federal Medicaid requirements prohibit the use of waiver funds for room and board. So individuals who are on waivers typically would have to rely on SSI, wages from work, or maybe family finances to cover housing costs. Some county boards provide subsidies to help with these costs. So this is obviously in contrast to an ICF, which is considered a bundled service, and so those living in these institutions wouldn't have to pay for room and board. Okay, so it's incredibly important to note that county boards are mostly responsible for raising the money to cover the non-federal Medicaid share for the cost of waiver services. So again, in contrast to the ICFs, where the state is responsible for the non-federal share for waiver services, boards are primarily responsible for raising the match. This mostly comes from levies. We'll talk about that a little bit more later on. So as of February 2015, we had about 35,000 people total on DD waivers in Ohio. Again, there's 4 different waivers available for individuals with developmental disabilities. We have the IO waiver, or the individual options waiver. This waiver is really the closest thing we have to an all-inclusive waiver. It has no individual cap, covers a wide range of services. The average cost is about $66,000 per year. So you can see much less than the annual cost at ICF or developmental center. However, costs for people on this waiver, because there's no cap, can exceed $100,000, $200,000 per person annually in some cases. The level 1 waiver is a capped waiver. The cap varies, but it's typically between $5,000 and $8,000 depending on the services and the situation. Given those caps, these waivers are often used for one-time cost or emergency needs. The SELF waiver, or the Self-Empowered Life Funding waiver, is capped at $40,000 for adults This is a self-directed waiver, which means that individuals can self-direct where and how services are provided. So people on these waivers have both budget authority and they have employer authority. So either the individual or oftentimes like a financial management company can act as the employer of record. Lastly, we have the Transitions DD waiver, or the TDD waiver. These are individuals who were previously served on the Ohio Home Care Waiver through the Ohio Department of Job and Family Services and then transitioned to this new DD waiver. The cap for this waiver varies. On average, it's about $25,000 a year. And unlike the other waivers we just talked about, the TDD waiver does include nursing services. I also wanted to mention that other state agencies, including the Ohio Department of Medicaid and the Ohio Department of Aging, also administer waivers for their consumers. Okay, so this shows you the breakdown of waivers by type as of February 2015. The most utilized waiver is the uncapped IO waiver, followed by the Level 1 waiver. The South waiver, which is just a very small sliver here, is a new waiver introduced just a few years ago in 2012. So as you can see, this waiver has really low enrollment, less than 400 people throughout the state. These waivers have received some criticism. They've experienced a lower than expected take-up rate. Since even though they have a higher cap than a Level 1 waiver, many boards find that they can be difficult to use. But others maintain that the South waiver helps to promote consumer choice. Remember, it's a self-directed waiver, and it can be a good middle ground between the Level 1 waiver and these costly uncapped IO waivers. So overall, in Ohio, our waiver program grows as we seek to downsize ICFs and move people into the community. Waiver growth has quadrupled since 2002, and that's in spite of the recession. So even though our waiver program is growing, it also has some pretty significant challenges. We have about 45,000 individuals currently on the waiver waiting list across the state. This list grows by 100 to 200 individuals each month. Last year, some of you may be familiar with this, a study was commissioned by the Developmental Disabilities Council in Ohio, which took a deep dive into the waiver waiting list. It really looked in depth at the list. So the researchers contacted a sample of individuals from the waiting list to find out more about their situation and to find out really what their needs actually were. And the study found something interesting, which is that about 22,000 of the individuals on the waiting list had current needs that were not being met, but the remaining 46% reported no current unmet needs. So these individuals likely have future needs, but they didn't need anything at the time of the survey. So this suggests that many people sign up for waiver services in anticipation of future needs, likely as a result of these historically long waits. So even though the waiting list may not be a completely perfect or accurate metric, we know there's still a significant number of people who are waiting for services. The study also found that the median wait time to receive a waiver is over 6 years. We know that currently 1 in 3 individuals living in ICFs is on the waiting list to receive a waiver so they can receive community services. And there's lots of factors that have led to this waiting list. Of greatest significance is the funding dynamic in Ohio. Like we've talked about, boards have to raise local money to pay for the waiver match, and many lack the funds to fully support the waiver needs of their counties. Also, because boards don't know what an individual's costs might be in the future, planning can be really difficult for boards. If you have someone on an IO waiver, which doesn't have a cap, their costs could potentially skyrocket, particularly as they age. So boards may be reluctant to grow their waiver programs too aggressively. We also know that funding isn't the only factor here. Some boards are choosing to spend their money on other services and sometimes less integrated services. Okay, so this map illustrates the percentage of individuals with developmental disabilities who are receiving waiver services. This is, again, based on those prevalence estimates from Scripps. And you can see a great deal of variation across the state here. Darker areas represent counties that have a higher percentage of individuals on waivers. So rates range from as low as 14% in some counties to over 50% in others. So you can see that individuals may have greater ability to access waivers in certain counties. Okay, so the Ohio Department of Developmental Disabilities has recognized that there are many people living in ICFs who may be candidates to live in the community with supports, and that our current funding mechanism doesn't provide an adequate number of Medicaid waivers to meet this demand. So there's been some minimal efforts over the past few years to downsize the size of our large ICFs and to convert ICF beds to waiver slots. That's what this graph demonstrates. However, while our developmental centers have downsized considerably over the past several years, we've had several hundred people move out of developmental centers, downsizing and conversion has been very slow with private facilities. As you can see here, almost 90% of beds over the past couple of years have not been impacted by this at all. You know, we know private ICF providers, many who have invested significant capital costs, have been seeking more incentives to make these changes, which they know will have a significant impact on their business models. This is something the governor is hoping to address in the budget, which we're going to talk about in just a little bit. So I'm going to hand this over to John now, who's going to begin by talking about employment services and supports. And just please remember as we go, if you have questions, just type them into the chat box and we'll do some Q&A at the end.
Good afternoon, everyone. This is John Honeck. Let's move on to discuss day service and employment. Boards and private providers can offer a range of services and supports. With the growth of waivers, Medicaid is the primary funding source, though boards typically supplement the cost of these services. These services are often referred to as the adult day array, which offer options throughout the day that are designed to engage individuals, to teach them life skills, help them with social interaction, and provide some opportunities to integrate them into their community through day trips. A typical service is called a sheltered workshop, which offers vocational services in a controlled setting. Sheltered workshops employ individuals with developmental disabilities separately from others without disabilities. Individuals are paid for their work based on their productivity level. However, this means that many individuals earn less than the minimum wage. According to research conducted by the Columbus Dispatch, more than 35% of individuals in Ohio's workshops, or about 5,200 workers, make less than $1 an hour, and nearly 1,000 make less than $0.25 an hour. So there's a vigorous debate going on now about sheltered workshops. Some advocates argue that sheltered workshops isolate and segregate, and that they minimize the potential of many people with developmental disabilities. However, some individuals with developmental disabilities and their family members continue to praise their benefits. They maintain that many individuals with DD cannot fully adjust to community employment and will face harassment or bullying, and that the community at large is not ready and willing to accept integrated employment. But we do know that there are individuals with disabilities who aren't employed in the community and who want to be. According to the National Core Indicator Survey, 36% of Ohio respondents who did not have a paid job in the community wanted paid community employment. And while initially the goal of sheltered workshops was to prepare individuals for work in the private job market, this is frequently not the outcome because the skills acquired through sheltered work are often not transferable to other jobs. Of course, community employment is another option for individuals with disabilities, with or without supports. Here's the breakdown of what day settings people are in, keeping in mind that individuals can receive more than one type of service. We still rely heavily on sheltered workshops in Ohio. Over half of all individuals accessing day services are in sheltered work. And the funding situation is even more skewed. Over 90% of the system's employment dollars are going towards sheltered work, at least in 2012. Let's talk about employment first. In 2012, the Employment First initiative began to be implemented wide. The new philosophy mandated that the DD system shift its focus toward vocational training and supportive services so that community employment would become the preferred option. The goal is that individuals with developmental disabilities can find community employment that not only gives them greater financial independence, but also further integrates them into their communities. The philosophy behind the policy is the presumption of employability for all. In other words, that every individual will be involved with community work and life, recognizing that the time and the steps it takes to reach this goal may look different for everyone. Not everyone will want to or be capable of independent, integrated community employment. So a continuum of options or a pathway are possible. DODD has a partnership with the Opportunities for Ohioans with Disabilities Agency. OOD counselors are located around the state to work with individuals referred by county boards to obtain vocational training and other employment services. SSA case managers are starting to work with individuals who are still in school and their families to start talking about community employment. Employment First progress in changing the employment landscape has been very slow. Community employment grew by about 800 individuals from 2012 to 2014. As of October, 17,000 individuals were active in sheltered work. An additional 6,300 were participating in adult day, and 8,100 were employed through integrated work programs, representing just 26% of all activities. There are some critics of Ohio's community employment efforts who argue that we are not doing enough to support this work, and that the current system and the partnership with OOD isn't always easy to navigate. Let's take a look at the overall funding for the system. Federal funds make up the largest share of revenue supporting DD services in Ohio. This mostly comes from the federal Medicaid share for waivers and ICFs. However, Ohio still ranks 47th in the nation for Medicaid spending as a percentage of total DD spending. So most states are utilizing Medicaid funds to a much higher degree than we are. This is because of the large amount of unmatched local funds. Total state appropriations for DD services totaled $2.4 billion in 2014. Keeping in mind that this includes over $300 million in county board waiver matching funds, and about $460 million of the state appropriation supports ICFs, while about $1.4 billion supports waivers. Overall, Ohio relies more on local funds to support DD services than any other state. About 70% of the revenue that supports local boards is local, mostly from property tax levies. The remaining 30% come federal and state sources. This is important in that it creates a dynamic which has implications for service. Because of this reliance on local spending, we have a lot of variances in how boards have to operate. Some tax-poor counties have much less money available for services. However, this dynamic gives counties more local control than what you would see in other states. But where you live in Ohio can dictate the services that are available to you and your family. This is a map that shows that counties rely on local spending to varying degrees. The darker counties indicate higher degree of spending, the lighter comparatively less. So the amount spent in 2012 ranged from less than $5,000 per individual served to more than $34,000. We have several other maps included in the report which demonstrate disparities in different service offerings. Let's spend the remainder of our time talking about some current issues and challenges that are facing the system. On July 1st of last year, Disability Rights Ohio sent a letter to Governor Kasich, the DODD, the Office of Health Transformation, and the Department of Medicaid, which received a great deal of attention. This was the result of an investigation that they conducted across a variety of settings. Through this investigation, they found a great deal of segregation, isolation, and lack of independence in ICFs and day programs across the state. In the letter, they provide several examples. I will read one such example. For the past decade, DJ, age 35, has lived in a 32-bed ICF, which he describes as a form of incarceration. He wants to live in the community, a choice his guardian supports. But for 12 years, he has been stuck on a waiting list for a Medicaid waiver that would provide a home in the community. He also wants to work in the community and earn a paycheck, but instead, he is assigned to a day rehabilitation program on site at the ICF, which offers no opportunity for wages or integrated employment. The DRO letter states that Ohio is in violation of federal law, specifically the Americans with Disabilities Act, which states that unnecessary segregation of individuals is discrimination, and that services should be in the most integrated setting possible. Disability Rights seeks to make the case that the system design in Ohio favors institutional placement over waivers, since counties pay the bulk of the bill for community services, while the state picks up the tab for institutional care. DRO also outlines concerns with waivers in Ohio, including the lack of nursing on the IO waiver and other restrictions like caps for the Level 1 waiver that limit the services people can get in the community. Disability Rights proposed some remedies that would increase access to the community and requested a meeting to discuss these issues. We know that the meeting with the state took place and that the state took the concern seriously, even if they didn't fully agree with everything in the letter, which I think you will see as evident when we discuss the governor's budget proposal. Let's talk about the CMS rule change. New federal rules from the Center for Medicare and Medicaid Services, or CMS, will also change the landscape of DD services in Ohio. These rules apply to Medicaid waivers for home and community-based services. They do not have an impact on non-waiver services, such as ICFs or DCs. The changes to Medicaid rules have narrowed the types of settings in which Medicaid reimbursable services can take place, with a greater emphasis on integrated community-based settings and outcomes. As we discussed, Medicaid is the primary payer for DD services in Ohio, so these rules will have a major impact. These rules were intended to guarantee that individuals served through Medicaid waiver programs have access to community services to the same degree as individuals not receiving waiver services. The rule changes were announced last January. However, states were granted some leeway to come into full compliance. Let's talk through a few key changes in the rules. One of them is called person-centered planning. Service plans developed by SSAs must be individualized and reflective of the individual's preferences for service type and delivery. Measurable outcomes should be included in planning, which should be facilitated by the individual with the disability whenever possible. Planning should also include any friends, family members, or advocates identified by the individual. And many boards feel that they are already compliant with this rule. Residential services will be impacted as well. They will preclude waiver services, like Medicaid waiver homes, from being delivered in settings that segregate or isolate. So day services or waiver homes that are on the grounds of institutional settings may not be in compliance. Additionally, the rules require providers to assure the right to privacy as well as open access to food and visitors. Sheltered work and day services, as they have traditionally been delivered in Ohio, will no longer meet the requirements outlined in the new rules, except as a pre-vocational service, as these settings are seen to largely isolate individuals and don't allow for full access to the community. And that's going to be a huge change. Also of significant interest, the rule calls for conflict-free case management. As discussed, the county boards directly employ service and support administrators who act as case managers. In addition to this case management service, the county boards also provide service directly to individuals, including services funded by Medicaid waivers. According to CMS, there is an inherent conflict of interest in this structure. In other words, you cannot own a service or provide a service directly and also provide case management. Essentially, boards are being forced to privatize. This will have a major impact on boards who still offer a lot of services directly, and a less severe impact on boards that have already privatized. Some boards have issued public comments criticizing the rule change. stating that it limits the board's ability to offer a wide range of services, that it decreases client choice, and that relying on private providers could diminish the visibility of the DD boards with voters, thereby jeopardizing their levy support. States will have as many as 5 years to come into full compliance with the new rule. Ohio is requesting 10 years for certain provisions. DODD worked to develop a transition plan to outline how they will come into compliance with the rules. The plan was submitted to CMS just a couple of weeks ago, and we will wait to hear their response. They can accept or reject the plan. Let's talk about a few other challenges. Monitoring quality is an ongoing challenge. As the private provider pool grows, there is concern that there is inadequate oversight. Currently, DODD and the Department of Medicaid are responsible for credentialing and monitoring providers, although Ohio does not have state licensing for agencies delivering home and community-based services. Some feel that improvements are necessary to assure that only high-quality providers are able to receive approval to operate, and that action against potential problem providers is swift. And some have questioned whether county boards should play a larger role in managing oversight and quality assurance, as they are more likely to hear about concerns early through regular contact with consumers, providers, and families. Another major problem are the wages and turnover of direct support providers, or DSPs, as they're also commonly called. DSP positions in both ICFs and waiver programs are notoriously underpaid and often have high turnover rates. Annual turnover rates can range from 42 to 69%, with low wages and limited benefits being the primary reasons. There is a significant difference in DSP wages at private ICS versus state-operated facilities, and correspondingly, so turnover at DCs is much less. Another factor that comes into play are advances in technology, which are creating noteworthy changes in services for individuals with developmental disabilities. Ohio is beginning to adopt many of these new technologies, and stakeholders believe these developments will be an important factor in system changes. Another factor is the aging population, which will have significant impacts on this demographic and the availability of family or natural supports. Life expectancies are increasing for both disabled and non-disabled individuals. As a result of medical advancements and more evolved support services, people with severe disabilities can expect to live longer than they may have 50 years ago. Therefore, individuals will require care for a longer period of time, leading to increased costs. Similarly, adult caregivers are living longer, creating complex family dynamics that will have serious implications for the DD system. Currently, data suggests that more than 1,000 developmentally disabled individuals in Ohio on waiver waiting lists will lose their primary caregiver each year, creating an emergency need for increased external supports. As many of you may have heard, the governor recently introduced his budget for fiscal years 2016 and 2017. This budget requires approval by the Ohio legislature. In a couple weeks, the House will vote on the bill, and then it will move over to the Senate. The DD system is a major focus of the governor's budget. The budget included substantial investments in DD services, about $112 million more in state GRF dollars above 2015 levels. The department has announced that if approved, spending would target ICF downsizing efforts, increased funding for community employment, and most notably the addition of 3,000 new waivers. The proposed waivers will include 2,000 additional IO waivers and 1,000 self-waivers over the biennium. How these waivers will be allocated has not been finalized. However, they are intended to target those who are in ICFs and want to leave. Nursing services will be added to the IO waiver at state expense, which is something that advocates have been pushing for some time. A waiver rate increase is proposed to support wage increases for direct staff. It's about a 6% increase. And about $2.8 million is being proposed to support community employment, to support employment first. There are also modest incentives for ICFs to promote downsizing. including a modest bed buyback fund. The budget also includes a small amount of rental assistance for those who are leaving ICFs because waiver services do not include rent. So we have a number of recommendations from our report. You can review them in full online. But as a result of our work on this issue, we feel that the state should develop a long-term solution to the complex waiver and waiting list problem. This should include examining options to increase the financial capacity of counties and to add state-funded waivers. Specifically, we target the tax equity line item in the state budget, which was initially developed to help to equalize funding for tax-poor counties. It is currently funded at about $14 million annually, which is woefully inadequate. We recommend increasing funding for this line item. Additionally, we recommend increasing state support for individual waivers that have an excessively high cost, so that counties are not always on the hook for these really high-cost consumers. We also recommend developing a solution to increase state-funded waivers over time to ultimately end the waiting list. Second, we would like to see increased funding for Employment First. The state should improve the partnership with Opportunities for Ohioans with Disabilities and streamline access to employment services. We don't believe that the current funding is sufficient to support the number of individuals who will be relying on community employment supports. It became clear through interviews that there are some counties who are not tapping into OOD and Employment First resources to the fullest extent possible, and this can be improved. We'd also like to implement changes to accelerate ICF downsizing and conversion, including decreasing rates for beds serving those with lesser levels of acuity. This is part of the budget. The changes in the governor's budget are a good start, but additional measures may be necessary to see real change. We also would like to see additional housing supports to achieve successful community integration. Housing will likely be a growing challenge in the coming years. As more individuals are served through waivers, housing needs will grow. The state is starting to recognize the growing need, but more should be done to work in collaboration with boards and other stakeholders to develop solutions. We'd also like to see the state undertake an examination of the self-waiver to remediate barriers to use. Given that additional self-waivers are included in the governor's budget, this is important so that these waivers are fully utilized. We'd also like to see a complete assessment of waiting lists to identify who is the greatest levels of unmet need and assure that these individuals are targeted for enrollment in the most appropriate waiver. And finally, we'd like to see increased collaboration among boards, and this is already happening, but we think there are further opportunities to create opportunities for cost savings and increased efficiency. Now I'm going to turn it back over to Callie, and you should feel free to ask questions. Thank you very much.
Thank you, John and Rose, for that informative presentation. A reminder to our listeners, you can submit questions for Rose or John in the chat box in the bottom left-hand corner of your screen. So we'll give you a few minutes now to type any discussion topics or questions that occurred to you during the presentation. I think Rose has a brief announcement she wants to make.
Oh, yeah, I just wanted to chime in and just kind of give a shout-out, say thank you to the many, many, many folks who talked to us over the last several months while we researched the system for this study. I think several of them may even be on the line today. We just, as many of you who are on the call probably know, this is a really complex system, and we really relied on discussions with experts, both at the State Department, at county boards, private providers, folks who've been doing advocacy in this area for a long time to really inform our work. So I just wanted to say thank you to all those individuals who took time out of their busy lives to talk to us and answer our questions and all that.
Okay, thanks, Rose. We don't have any questions for you guys. We do have a suggestion to add, in addition to streamlining access to employment services, that this recommendation could also act to avoid potential duplication of services. Now we have a question coming in. John, do you want to take this and let Rose follow up? It's what will the future for sheltered workshops look like as far as a work setting for people with disabilities?
Yeah, thank you. So, I think it's going to look somewhat different over time. The state has asked for 10 years from CMS to make the transition. So we've heard, various options being explored. So one option would be so-called reversed integration, where, a board might be able to bring in folks who are not disabled from the community, into, the workshop or whatever setting and create a more integrated work environment. I think you might also see, I think you just generally see a more of a transition to community employment. I think you're going to see workshops used more as sort of a pre-vocational service. In other words, while someone's looking for a job, starting a job search, there's some training and other assistance provided but for a defined period of time. It won't go on necessarily for many years. It would be a limited service, and then that individual would be asked to hopefully to find a job in the community. But there could also be scenarios where people get a job in the community, maybe, and they come back. But if the CMS rules stay in place, I think it's pretty clear that workshops will not look the same 5 or 10 years from now as they do in the future.
If I could just add one comment there as well. I guess take us two comments. One, I think that the department always emphasizes that the Medicaid rules are specific to settings, not to services. Now, we know that changing the setting will change the service, but it's not that individuals are no longer going to be eligible for a specific day service or for a certain service package. It's just that settings like workshops or most adult day programs are no longer going to meet the requirements that Medicaid is laying out there. The other thing that I want to mention, because I've heard this from some boards, is that it would be challenging, but it's certainly possible that some county boards or some local communities would try to find ways to continue some of these services without Medicaid funding. Obviously, that's going to be really, really challenging. We know that Medicaid is the primary payer for those services, but because we have so much local control in this system, that's always a possibility.
Thanks, guys. We have a comment about funding for ICFs in the future. The county board operated ICFs are systematically reducing the number of individuals served, and there should be a 19% reduction between 2012 and 2018, looking into the future. Another question is, how do states that don't have local county funding pay for disability services? I don't know if you guys came across that in your research or if you are focused mostly on Ohio.
Well, Ohio is sort of unique. It's our understanding that, in the degree of local funding in the system. In most states, the state is paying for the Medicaid match, and you just don't have as much local funding, going into the system at all. Now, in some cases, that means that the state is not doing a good job of providing a lot of support or putting in a lot of resources, then the system maybe isn't that good. But Ohio is just somewhat unique in the scale of the local funding.
The other thing I would say here, like John mentioned, Medicaid is really the primary funder for all of these services across the country because most of these individuals qualify for Medicaid. And like John mentioned, we are 47th in terms of our use of Medicaid funds to fund these services. So we know other states are probably tapping into Medicaid to a greater degree than we are to fund these services.
Thank you. Could you guys address the need to improve supported decision-making or guardianship services for people living with intellectual disabilities or developmental disabilities?
Well, we did not. Yeah, go ahead, Rose.
No, I was just going to toss this to you, definitely.
Okay. I mean, we didn't. The guardianship issue has been in the news a lot lately over the last year or two. And that was not something that we looked at in great detail in the report. I know some of the the court system has taken another look at sort of how we do guardianship in Ohio to try to create a system that works better for people. And I think that is something that, as you look at total system reform, all the stakeholders are going to need to take a look at that. And I mentioned the aging caregiver issue. There's going as maybe the parent becomes unable to be that to be in that parental role. There's maybe a greater need for guardianship for a lot of adults with developmental disabilities. So definitely an issue. We don't since we did not interview folks specifically about this. We don't have specific reforms that we're recommending.
Thank you, John. I have a question about integrated employment and talking about the role of the state in actively seeking out employers in the community, like grocery stores, hotels, larger chains. Is there any indication that the state is going to be more active in seeking out potential employers of people with developmental disabilities, or is there any sort of incentive for employers to hire people with disabilities?
John, you can chime in here as well, but I've not seen anything that suggests that the state was going to take a more active role in seeking employers. I know that's something typically that the boards or the providers who are providing these employment services would be able to do, and to reimburse for those services at least to some degree, or for those efforts to find community employers. In terms of an incentive for employers to hire persons with developmental disabilities, I'm not aware of anything like that. I do know that there is a campaign that's being worked on that's kind of supposed to be, I think, largely targeting employers to kind of dispel myths people might have about hiring people with developmental disabilities, which hopefully would be helpful.
I think this was an interesting discussion with some of the county boards that we interviewed, and there are different approaches out there. As Rose said, it was really sort of a local responsibility, at least as of right now, to sort of either on the providers or the board's part to develop those relationships with employers, and in some cases it seemed to be going pretty well. But sort of systematically having, incentives, that we didn't see that. So part of what we thought needed to happen with Employment First was sort of a big picture look at things and creating this sort of educational process for the community at large, and educating employers about, their ability to employ someone with developmental disabilities.
The other thing I'll just add in there is that they have spent the last, year or so, there's been a process to look at funding redesign specifically for the Employment First initiative. And one of the things that seems likely to move forward as a result of those efforts are like some kind of outcome-based funding system for Employment First, so that people who are working to connect individuals to to jobs may receive incentives or may receive payments based on outcomes. So did they actually connect someone to a job, and how long did that person stay in the job, that kind of thing.
Great, thank you. I know in the course of doing research and talking to people for this report, you really took a system-wide view of things and didn't look at any specific disabilities in detail, but we do have a question about autism and whether you know anything about a plan for addressing the specific challenges and significant costs involved in addressing autism.
That's nothing that I can speak to.
Okay, thank you. Do you have any idea if there will be more monies available for community-based services to balance their success in the community?
Well, I think the governor's budget is an attempt to, as I said, create these 3,000 new waivers, and I think as maybe you see a movement towards boards privatizing their services, you'll probably see more use of Medicaid waivers for various kinds of day support. So, I think there's some of that money is being provided in the budget. We just felt like it probably wasn't enough to, and we know it's not going to be enough to really clear the waiting lists or to sort of solve the problem. But the governor's budget is an attempt to sort of take some steps forward and moving the system along towards more of a community-based system and less institutionalization.
Thank you, John. This question is probably best for you as well, John. In your talk about the new Medicaid rules, we have a question about if conflict-free case management is new in those waiver rules or if it's always been there in some shape or form.
Well, it's always been there to a certain extent, and previously Ohio had something called a firewalls document, which for situations when boards had case managers and they were also providing services directly. The firewalls document laid out how the board was to separate the SSA case management function from the workshop or whatever the other services would be, and that worked for a while, but evidently CMS has decided that this is simply no longer going to be acceptable going forward, and as far as we know, there's people have been talking about, can we create a new firewalls document or revise it somehow? But, it seems right now that's just not an option, that, you're going to have real, totally conflict-free case management. And the issue now is it, what's the time frame for actually implementing that?
Great. Thank you both John and Rose for your presentation and all of the answers to the questions posed by our participants. We are going to wrap up here. I'd like to remind all of you that the full report and resources are available on our website at www.communitysolutions.com. The recording for this webinar will also be posted there in the next day or so if you have any friends or colleagues who wanted to join us but weren't able to make it. Thank you very much for listening, and we hope to talk to all of you again soon.